Now we're going to go back into the world, to the problem that humanity is facing together in these times. On TV, in the news, we see women as doctors, as nurses, as health workers. Clearly, women run the health services. Nearly 3/4 of workers in the health and social sectors are women. But what about their roles as unpaid caregivers? This session will discuss the critical contributions of women as unpaid caregivers in COVID response, when caregiving is perhaps more important than ever. Welcome to conversationists Felicia Marie Knaul, Lynn A, Lina Gálvez Muñoz, and Christine Heenan.
Thank you very much for that introduction and to that great conversation from Reykjavík, where I too hope we all gather this time next year. Welcome to a panel on the economy of caring, impacts of COVID-19. As you just heard, we have three distinguished panelists to join me for this conversation today. Lynn Taylor, who is the head of Global Healthcare Government and Public Affairs at Merck KGaA Darmstadt, Germany. Lina Gálvez Muñoz, a member of the European Parliament, and Dr. Felicia Knaul, Director of the Institute of Advanced Study of the Americas at the University of Miami, as well as leader of an NGO in Mexico focused on women and breast cancer. We're going to start with you, Dr. Knaul, and a presentation on data you've been working on that we're going to hear and see for the first time today about the impacts of the caring economy on women, paid and unpaid. Over to you, Dr. Knaul.
Thank you to WPL, and it's wonderful to be at the 2020 Reykjavík Global Forum. We're going to look at unpaid healthcare and caregiving, a gendered and hidden yet indispensable subsidy to economic and social development. Next slide, please. This work comes out of two main bodies of work around healthy women, healthy economies. First, the Lancet Women in Health Commission, published in 2015, in which I had the pleasure of participating, and also Healthy Women, Healthy Economies project, led by the Asia Pacific Economic Cooperation, APEC, and Merck KGaA Darmstadt. Next, please. This work speaks about the many relationships between women and the health sector. Women as consumers of healthcare, their own health, but also women as producers. And women produce healthcare both as professionals, like physicians, but also as unpaid workers. And this is what we're looking at, that unpaid healthcare and caregiving is a significant hidden subsidy for health and social care systems. It continues to be still unrecognized, unaccounted for, unregulated, unprotected, and deprofessionalized, as well as disproportionately the responsibility of women. Next, please. The research that we're going to present to you today is based on data from 49 countries representing 70% of the global population. And I want to highlight, however, the dearth of data that we have from low and lower middle income countries and how important it is to get more data for these countries. Next, please. Our research from these 49 countries, first around health-specific caregiving, those hours that are dedicated entirely to health, caring for a sick child, or perhaps a loved one at the end of life. This total unpaid health-specific caregiving, when we add it up and multiply by wages, is the equivalent of 4 to 6% of global 2019 GDP. Let's take an average of 5%. That's 4.4 trillion US dollars. What does that mean? Put it in context. It's 10 times the economy of Nigeria, or the equivalent of the sum of the entire economies of Canada and France. And that's only a part of the story, because when we add in health promoting caregiving, which are those activities that promote health and prevent disease, for example, spending hours looking for firewood to boil water so that it's safe to drink, or producing nutritious meals to support one's family, all of those hours, many more hours when we put them together, in a conservative estimate would say that this total unpaid caregiving sector is the equivalent of 12 to 16% of global GDP. And when we look at all of those hours counted hour by hour, our total lower bound estimate is between 30 and 40% of global GDP. Next, please. Very importantly, This large sector is mostly produced by women. 60 to 70% of total caregiving value comes from the hours invested by women. And about 20% of that is associated with wage differentials that are likely gender discrimination. And this gap is much higher, perhaps double, in low and lower middle income countries. Next, please. Look now at our data across a subset of countries. Mali and Pakistan, lower income countries, Brazil and Mexico, upper middle income, and then 4 high income countries that are included in our study. We're looking at hours in unpaid health specific caregiving here, and the message is the same across countries. Women produce and invest the majority of hours, over 80%, and in our lower income countries, over 90% of the hours that go into the caregiving sector, again, unpaid. Next, please. And the equivalent value of these hours across our countries give us 2 important messages. Again, country after country, women are producing the majority of unpaid caregiving. And that even before accounting for gender differentials, and certainly afterwards, the value is much higher despite wages being lower. When we look across our countries in terms of value, for Mali and total men and women, the unpaid caregiving sector is the equivalent of 50% of their GDP. And in some countries where both men and women are investing many hours, the case here is Canada, it's actually the equivalent. But again, the proportion from women is much higher than the proportion given by men. Next, please. And then in comes COVID that has taken our market economy to a grinding halt throughout the world. Yet the unpaid care sector is being in overdrive. These are data from 22 countries for Asia, the Pacific, Europe, and Central Asia from UN Women. And they show the percent reporting increases in domestic workload during COVID-19 by women and men across different types of activities. And again, the story is the same. More hours for women than for men, but overall more hours for both. Next slide, please. So COVID has magnified society's reliance on unpaid work and exacerbated gender inequality in the provision of care. Women are reporting overall spending 20 hours or more additional time per week on caregiving-related duties. What does this mean? Less leisure, less sleep, and probably lower productivity and less health for women. But next slide, please. We need to turn that idea on its head. Remember, women are the motors of economic growth, and they produce the majority of healthcare and caregiving. COVID can be a catalyst. It can provide the opportunity to re-engineer health systems to enable and empower women rather than disable them. But that requires gender transformative policies. These are essential to harness the opportunities of telework and telemedicine. Thank you.
Thank you very much, Felicia. And I want to say a warm welcome to you, to Lynn, to Lina. I'm not going to bother with your introductions because the audience can see them on the screen, and I know we want to get right into this conversation. It's one I suspect all of our fellow participants can really identify with in their own lives in their own ways. Certainly the women, but I think many men as well. I want to start with you, Lynn. Your organization has supported this work. Your company is in the healthcare business and it supports this research specifically. What interested you in the caring economy, and what about Felicia's presentation stood out to you?
So thank you so much to women political leaders and, of course, the government and Parliament of Iceland for hosting us, and Christine for moderating this dialogue today, which really does resonate personally with me, as well as so many of us during this really unprecedented time. So Merck is a leading science and technology company, and we're in healthcare, life science, and performance materials. And yes, in the US and Canada, we do operate as EMD Serono. And our company provides solutions for diseases that disproportionately impact women, like multiple sclerosis and thyroid disease. And so improving health outcomes for women and for girls is what we work toward every day. We are deeply committed to advancing the health and well-being of women so that they can join, thrive, and rise at home and at work. And this is for our employees as well as in society at large. We do recognize that caring has a unique impact on women. And I think as Felicia has shown us with these new exciting data, are that caring is a critical aspect of the global economy. And COVID-19 has really brought this more sharply into focus. Schools are closed, formal caregiving support for sick and elderly is becoming more and more scarce. Healthcare systems are being put under increasing strain. And this incredibly important unpaid work by carers, who are largely women, is becoming a greater portion of our economy. And so really, with so many still at home, more and more is expected of women and of carers. And unfortunately, it's these same carers that are shouldering the burden of the economic hardship due to the global economic impacts of this pandemic. Recently, UN Women predicted that COVID-19 will contribute to the worsening of the gender poverty gap, with an additional 26 million women now forecasted to be living in poverty by 2030, compared to before the pandemic. So part of this gender gap is due to the fact that women are more likely to have formal work in some of the most hard-hit sectors of the economy, like consumer-facing industries, retail, and food service. And they're also more likely to be in lower-paying jobs within these sectors than their male counterparts. So adding in lower-paying jobs as well as gender discrimination in income. And so for many carers, the demands of work and home during the pandemic has forced a choice between keeping their formal work and taking care of their loved ones. And so I would say that we are here to support women's economic and emotional well-being throughout this crisis. And I think we have to equally support them as carers. And this is why we commissioned Felicia's research. And I would say what surprised me and what didn't surprise me, the unpaid caregiving economy is in overdrive. With COVID, women are having a disproportionate impact on caregiving. The gap is widening. This did not surprise me. And the gender differential in income, right, we saw is greater in the lower income countries than middle and high income countries. Also, sadly, that doesn't surprise me. One point of data that did jump out to me that I'm curious to learn more about is in Canada. It looks like women share similar percentages of the burden of health-specific caregiving as other high-income countries, but the annual value of the health-specific and health-promoting caregiving is higher, and it was presented as the highest. So that's one piece of data I thought interesting and was surprising to see.
Thank you for that. And I want to come back to you in a minute, Lynn, about private sector trends and private sector interventions around what we've seen. But certainly what you've just spoken to, we were, before we began our panel, thinking, oh, you might be my dog or my child might run in. I think this panel and this conference are testament to what women are juggling and managing. So I want to go now to Lina and ask you as a policymaker, and specifically a member of the European Parliament, but speaking to policymakers everywhere, what are some of the practical policy considerations that we can create supportive environments for caregivers? And how might you think about promoting and advancing policies through the Parliament and through other government systems to address the kind of disproportionate burden that Lynn and Felicia have just both spoken about?
So thank you very much to Women's Leader and to all of you for inviting me to this meeting, specifically to this topic. I have to say that I wrote a book on the economy of care in 2016.
If I can interrupt for 1 second, Lina, others may not be having trouble hearing you, but I think I don't want to risk missing what you're saying. So maybe moving closer to your microphone.
No.
Okay, what I'm going to do is I'm going to go back over we're going to have you dial in by phone. We really want to hear your perspective on this. But then if I could just go back to you for a second first. You are part of a large organization in a large sector in a large global economy and are the member of our panel speaking to the private sector perspective and experience. Can you talk about ways private sector companies can practically address supporting women in these roles, especially what are the opportunities of doing so in the midst of a global pandemic in which these roles have become much more obvious to people? And what are the challenges of trying to right-size in the midst of a global economic downturn that resulted from the pandemic?
Yeah. Thank you for that question, Christine, because I have to say, I have been incredibly proud of my organization and how we have been managing through and with the pandemic. While all of what we look at does paint a bit of a grim picture, there is reason to believe that the pandemic is spurring change, bringing innovation and innovations in the workplace that can have a positive impact for women and carers. One is the rise of telemedicine. This is a really promising development for carers. It certainly doesn't resolve everything, but in an area where healthcare has been so, let's say, behind to use this technology, I think that it is going to really greatly benefit carers. And I can say, in my own personal case, I have found it to be very helpful. And we'll talk about maybe that a little bit later. Can
I just interrupt there for a second? Because I know Felicia has a thought on this very topic, telemedicine, and then I'll come back, Lynn.
Right. Absolutely. And I can't help but say something about Canada. We were surprised at the data too, but I wonder if this is, and I'm saying this as a proud Canadian, the Premier Justin Trudeau effect. Really what's driving a lot of this is we're seeing in these data more hours invested by men in caregiving than we're seeing almost anywhere else in the world. And so I can only say that as a proud Canadian, we're still reviewing this research primarily with my colleague, Bev Essu, but I want to find that to be true. On the telemedicine and telework, I think two ideas. One, I really think we can learn a lot by studying, doing research on the microcosm of female physicians who have become, the majority of students of medicine, and they're combining these roles in a very unique way. So that's something that I think we need to study. The other is to highlight the importance, given we lack these data for low and middle income countries, of looking at solutions. And I think we need to ask, what can we do with these large scale anti-poverty cash transfer programs that have been so successful all over the world? I'm very worried about countries that canceled those just before COVID hit, in the case of Mexico, and very thrilled with others who have used these as a base to be able to address, all sorts of issues, including income transfers for women who are trying to combine both. I think that's the sort of the sweet spot of asking, what can we get out of telemedicine and telework in a way that's gender transformative?
That's really helpful. I think looking for bright spots is something we should be doing and leaning into. Lynn, you had a second point about the private sector. Let me turn back to you.
Yeah, sure. Thank you. And I agree, Felicia. And I think this flexibility using technology, both for the workplace and for telemedicine and healthcare, is going to help us leap forward in achieving gender parity in employment. And only if both men and women, right, are able to take advantage of these opportunities equally. In our company, and I know in many companies around the world, increased flexibility in the workplace, allowing flex hours as well as telework, make combining caregiving and formal paid work easier. And I think this increased global connectedness, interconnectedness, that can really spur increased in learnings and best practice sharings around companies and around the world in our public health responses is going to be critically important because even for carers specifically, and we work with so many leading critical care caring organizations around the world, often the interconnectedness and the support lines from online communities and discovering resources is another important piece that for many have been inaccessible. And so with the rise of technology, we also need this access to the internet, right? And technologies. And so in the countries where these gender gaps are existing, we also need to make sure that internet connectivity is there. And at Merck, as I said, we have been committed to improving women and carers' lives around the world. And as an employer, we play an important part in caring for our employees. And we're constantly looking at ways that we can close our own gender gaps. We look intensively at our own data and our own employee base. We want to recruit, retain, and advance the most talented women. And so we have launched a Women in Leadership initiative that helps us work toward gender parity. We look at succession planning to make sure that when people put forward their succession plans, there's an appropriate representation of women. We're training employees around the world in unconscious bias so they can start to understand how unconscious bias can adversely impact women's careers. We used to often see panels put up on the stage internally or externally that are all men, right? And we want to make sure for interviews or other externally facing activities, we have men and women. And so flexible work schedules, employee assistance programs, peer-to-peer support, and really creating this culture of caring. And I know that, sorry.
No, I was going to say one thing I want to lean into that you just mentioned was taking all those examples and the others that have resulted from the improvisation companies have had to go through across the private sector, and researching and cataloging, lifting up all those best practices that have emerged by necessity, I think would be a great outcome. And I think of this Reykjavík Global Forum as one in which commitments come forward that begin the march of change for women around the world. So that would be a great one. I want to pause you there, Lynn, just because Lina has rejoined us, and the policymaker perspective is important to bring in here. So Lina, being a strong improvising panel here of all women, we're going to turn back to you now that your sound is better. Share with us the policymaker perspective.
Yeah, sorry about that, but now I hope it's fine. So I was saying how happy I was to be here. Sorry, because I have changed, so I missed some of the you were saying. So the first thing, it is important that from policymaking we know the reality. We know care work is completely and absolutely completely imbalanced in all countries, both paid and unpaid, both formal and informal, both public, private, communal, or family driven. So it's in every single country, although there are important differences, it is completely gender unbalanced. So the first thing we need is good data. Good data, as the time I escaped, there was someone talking about Canada. I couldn't listen what he was saying about Canada, but Canada or Australia has been at the forefront of producing not only gender disaggregated data, with a lot of intersectionality, but also more feminist or gender-driven statistics. So we need better statistics in order to know better how this care burden in the different ways is shared. Because sometimes, and even the motivations and the problems, because sometimes it's made for love, other for money, sometimes because someone is waiting for inherited from an older person or the family. There are many different motivations, and in the different places, both in private or in communal places. So we really need to know more, and in order that also this care work is not naturalized to women, because that's the problem politically, the problem that we don't know yet, even if we have data and so on and so forth, how important is the care work in order that everything in the economy could work. During the COVID crisis, it was quite clear. And so we need, and I will stop here, we really need a third transition. At the European Union, we are talking all the time about the twin transition, which is the digital one and the green transition. And we really need to put at the same level a third transition, which is a new organization of care, where all this work is considered, and we really will know how unbalanced it is shared, because this time it cannot happen as in previous crises, that the work burden for women has increased in all crises, that female employment has recovered later on that male employment, and so why we have had backlash on gender equality. So this time must be different, and we are taking some consciousness about how important is care, but still it is something like not mainstreaming, and we really need to put on the mainstreaming and to put it at the same level as the green and digital transition, in my opinion. Thank you.
So let me stop you there and just ask, because we have only a few minutes left, some big themes. The idea of more data you just spoke about, Lina, Felicia talked about as well. I think, Lynn, giving guidance on how that data can be presented in compelling ways to private sector decision makers so that real change is brought about. But in our last minute, I just want to talk, the four of us, about how have you personally been impacted by this phenomenon, by the phenomenon of unpaid work, both in your lives and then with the added burden of COVID. Does anyone want to speak to that before we wrap?
So quickly, I was thinking about the last 2 years at this forum. The first year I talked about my breast cancer experience. So as a woman who's lived breast cancer, it's, the hope that telemedicine could actually do something about the other pandemic of non-communicable diseases and particularly cancer, particularly for women, and bring healthcare closer to them by having them have to travel less. And the other is that last year in a session in which my daughter gave personal testimony to say that while we say all the awfulness of COVID generating additional burdens for us, it's given us a tremendous opportunity to be able to calmly combine being with our family and work, not having to travel for many of us. I know that's a high income country message, but the question is, how can we translate that into a message that's also good for women who are living in poverty?
Unfortunately, because we're out of time, I just want to leave us all with that idea. How can we take the dimensions of this extraordinary last 9 months and the challenge it's brought about to say, what are the takeaways we can bring to making lives better for women around the world, and how do we make that spread? Thank you all very much for joining this conversation, and please review the data that's been shared and will be shared through the forum going forward. Thank you, Lynn. Thank you, Lina. Thank you, Felicia, for joining.
Thank you.
Thank you.